I'd like us to rise up for the national anthem. And just before that, please just help us and see to it that your phone is on silent mode, because we are streaming this event live. We are being watched in different parts of the world, because what we're doing here today is something very, very important, and we believe that if we can keep our phones quiet, it will go a long way to help us. The national anthem, please. Thank you very much. You may be seated. Distinguished guests, ladies and gentlemen, I'd like to welcome you to this very, very special occasion of the official launch of the Trauma Care Emergency Response Application, one that we believe would go a long way in helping to save lives. We live in a country where arguably about 39,000 people die daily from road accidents, various accidents. And we believe that the intervention today that we are witnessing, along with many others, both by individuals, governments at different levels, and all these concerted efforts would help to save lives of our citizens. The Trauma Care International Foundation, since its inception, has executed over 10,000 safety and emergency response projects directed towards various organized communities, such as school children, teenagers, law enforcement officials, teachers, corporate organizations, and many others. This foundation, the Trauma Care International Foundation, has been vitally involved with increasing the awareness of the benefits of voluntary blood donation and expanding the pool of safe, unpaid, voluntary blood donors in its member nations. It went ahead to win an award where it was listed in the Guinness World Books of Records as the largest single donation of blood within the shortest possible time the world has ever seen. The Trauma Care International Foundation hosted Nigeria's first trauma conference that brought together the high and mighty in the trauma management sector in Nigeria. Today again, the Trauma Care International Foundation is recording another major step in its efforts to contribute to the health sector to make life easier for citizens. And with the development of the TCERA application suite and an expanding network of volunteer first responders, this foundation is set further in contributing to improve pre-hospital care and emergency response in our nation. It is on this note that I'd like to welcome quickly the chairman of the Trauma Care International Foundation. I know that we have a lot of guests that are seated here. I didn't want to be calling names of maybe those who have not been seated, but distinguished guests, let me quickly, before I call on the chairman, the esteemed CEO and chairperson of TCIF, represented by the esteemed Pastor Dr. Emeka Eze, I'd like to recognize some very distinguished guests that are seated with us here today. We have the representative of the Honorable Commissioner of Health, Lagos State, ably represented by Dr. Adeolu Arogudade. Please, a round of applause for him. I also want us to recognize Dr. Olusegun Ogboye, who is also ably represented. Please, if you are representing the PAMSEC of the Ministry of Health, please let us know, and then we can also let everybody here know that you're here. Dr. O.A. Kola Korolo, Director of Lasambos. Thank you very much, sir, for your presence. Dr. B.I. Oshikomaya is present here. Please put your hands together for them. These are distinguished persons who have committed to being here. And Mr. Olusegun Ogungbemide of the Lagos Sector Commander of the FRSC, ably represented, I think. Please put your hands together. Thank you. Ably represented by Mrs. Fekoya. Thank you. Please put your hands together for her again. I also want to recognize, if present, the National Coordinator of the Scouts Association of Nigeria, Engineer Oyetayo Babatunde. Okay. Dr. Banke Odunsi, an Assistant Director and the Head of Lagos State E-Health Unit. Let's put our hands together as we call their names. And I'd like us to recognize here Mr. Femi Da Silva, if present. Let's put our hands together for him. Please also join me in recognizing Pastor Dr. Emeka Eze, the representative of the chairman, Trauma Care International Foundation. Let's put our hands together for him. And all other distinguished gentlemen of the press who are here, ladies and gentlemen, permit me at this point to invite for his remarks the representative of the chairperson of Trauma Care International Foundation, Pastor Dr. Emeka Eze.
Good morning, distinguished guests, ladies and gentlemen. I want to once again welcome you to this very auspicious occasion, the launch of the TCERA app suite today, the 25th of March 2021. The patron, Trauma Care International Foundation, Reverend Chris Oyakilome, DSCDD, the chairman of the TCERA app launch, the Honorable Commissioner of Health, Lagos State, ably represented, distinguished directors of Lagos State Emergency and E-Health agencies, distinguished chieftains of emergency and health care, captains of medical and paramedical services here present, representatives and stakeholders of trauma care and emergency response, healthcare providers, members of the press, distinguished guests, ladies and gentlemen, all other protocols observed. Good morning. I want to thank you all for making time out of your busy schedules to join us this morning in making a difference in Nigeria and Africa as a whole. I want to welcome us all to an overview of the TCERA App Suite launch under the auspices of the Trauma Care International Foundation. It's my pleasure to welcome you to the launch of the Trauma Care International Foundation's Emergency Response Application Suite, comprising of the TCERA Responder and User apps, and it's a first of its kind in Nigeria and in Africa. We are honored, thank you very much. We are honored to have key stakeholders in trauma care and emergency response present here today as we unveil these new innovations designed to usher in advancements in pre-hospital care in Nigeria. Among us today are veterans and specialists who, like us in the Trauma Care International Foundation, have committed themselves to ensuring improved outcomes of traumatic emergencies in our communities. We have a great inspiration to improve trauma care. One of the most important things about trauma care is that trauma is still the leading cause of death in individuals between the ages of 1 and 44 years. Amazing. And it's the third most common cause of death regardless of age. Nigeria's accident rate is the highest in the world by a very long distance. And it still contributes a very, very large percentage of the deaths. People have died more in road traffic accidents in Nigeria than all the people that died in the Civil War combined. So we actually are dealing with a very serious issue. And the first responders determine survival, how the patient is handled, whether the patient is handled at all. So in this part of the world, this is a very major issue. In Nigeria, we have over 4 million injuries recorded due to trauma and more than 200,000 deaths attributed to road crashes alone. So what can the Trauma Care International Foundation do? What's our role in addressing the issue of trauma and emergency response? As a non-governmental organization, we have pioneered and championed many innovations, all of which have been aimed at improving trauma care and emergency response in Nigeria and in other nations. Since the inception, TCIF has been actively engaged in executing mass health and safety education and advocacy campaigns, hosting of voluntary blood donation initiatives in partnership with relevant government agencies. We hold the world record in the Guinness Book of Records for amount of blood donated within a period of time for the past 2 years. Praise God. In addition to these notable achievements, in December 2019, TCIF organized the first ever trauma conference in Nigeria. We brought together relevant key international, national, and state stakeholders in health, trauma, and emergency care to discuss key strategies and platforms for improving trauma management in the nation. What's the objective of the TCERA app launch? Now, this is very important. The foundation recognizes the Lagos State government's efforts in provision of adequate pre-hospital care for trauma and emergency victims. Lagos is one of the fastest growing cities in the world with one of the highest populations in the world. being estimated at between 24 to 25 million people right now. It has a very large road network with attendant challenges for trauma and accidents, apart from domestic accidents and several other causes of trauma, construction accidents, collapsed buildings. We can go on and on. So there's just so much that is required in terms of taking care of this large population of people when the number of emergencies increases with the population. So one of the things that has already started in provision of adequate pre-hospital care for trauma and emergency victims, and to further aid and support this ongoing laudable work in the health sector, the foundation has been training volunteers in first aid skills. This has been going on for several years, and has formed a network of volunteers trained in first aid and basic emergency response. They are referred to as the TCIF First Responder Network, and they are located all over Lagos State. Furthermore, leveraging on technology, the TCIF designed and developed the Trauma Care Emergency Response Application Suites. That's what is referred to as the TCERA apps, which we are launching today. This network is made up of volunteers from all walks of life. They are willing citizens trained to provide first aid to those who need it. These two initiatives underscore the TCIF's commitment to improving emergency response. And we have been actively engaged in expanding the available pool of skilled first responders to improve outcomes of traumatic injuries in communities by recruiting, training, and equipping volunteers, and also by strengthening collaborations with existing emergency response agencies, as we can see, are represented here in this occasion. Some of our strategic partners in this project include the Lagos State Ambulance Service, the Federal Road Safety Commission, the Nigerian Boy Scouts Organization, the Lagos Neighborhoods Safety Corps, and many others. We expect that the outcome from this launch, our hope is that the deployment and use of these applications within the Lagos metropolis by its residents will not only help reduce the morbidity and mortality rates associated with injuries, but their use will complement and lend support to the impact of the existing emergency response framework being commendably financed and managed by the Lagos State government. We look forward to opportunities to collaborate with the existing trauma management structures, both at state and local government level, and to scale up the deployment of the application across the nation. Numerous opportunities exist for relevant stakeholders to cooperate and corporate organizations to collaborate with the Trauma Care International Foundation in delivering these sustainable solutions towards contributing immensely to improving on the pre-hospital care that we have available in our nation, Nigeria. Remember, when it comes to trauma, pre-hospital care can determine whether hospital care is required or not. In conclusion, ladies and gentlemen, I trust that you will enjoy the discourse and participate as required. And I trust that our speakers and panelists, both virtual and on-site, will help to enlighten all of us and to galvanize us to take decisive actions and to help us achieve our collective health care goals. Once again, I welcome you to the TCERA app launch. God bless the Federal Republic of Nigeria, and God bless Africa. Thank you so much.
Trauma Care International Foundation was established on the 5th of January 2012 as a registered non-governmental organization with the vision to improve the state of trauma care and emergency response services in Nigeria and its member nations through health education, advocacy, and community-based programs. TCIF is a Guinness World Record holder and a non-governmental organization in special consultative status with the United Nations Economic and Social Council since 2019. With trauma listed as one of the leading causes of death globally and contributing extensively to the thousands of deaths recorded every year in Nigeria, Trauma Care International Foundation, in line with its objectives to significantly reduce the delay in patient evacuation and the institution of pre-hospital care of trauma cases, launched its Emergency Response Initiative in 2020 to further address this through community-level incorporation in the provision of prompt and effective emergency care.
My name is Oyedepo Miriam Nneka. I'm a resident of Lagos State in Nigeria. I'm so excited to be part of this training today because beyond just adding of knowledge, I've come to realize that it's a responsibility for every citizen to be conscious of being safety and saving lives around the environment. For what I've learned today, I have a role to play, and my role is to join this team, undergo every training that is necessary for me to go through, and much more, very importantly, be certified so I can put to work every training to save lives in my environment, to respond immediately in case of any emergency around me, not just to walk away or to shout like every other ignorant citizen, but now I know my role in the society, in nation building, and at large, for every one of us to stay safe and also to build a better nation.
The Foundation designed and launched a network of individuals from every walk of life, trained to provide emergency medical first response to victims of trauma before the arrival of the emergency medical services. This network is known as the TCIF First Responder Network.
I am Engineer Babatunde Oyetayo. I'm an aeronautical engineer, and also I'm the National Executive Commissioner for the Scout Association of Nigeria. In Trauma Care International Foundation, I haven't come up with this initiative. I believe that there's a lot they are going to do to save lives in Nigeria, and they have started. For us in the Scout Association Nigeria, talking as a national officer, this is a grand opportunity for us to partner effectively with Trauma Care Foundation International. And I, as the National Executive Commissioner, I'm going to raise the stake to be able to partner effectively. We're going to put up our letter of partnership to the foundation so that we can reach more people.
The pilot phase of this project kicked off in the city of Lagos in 2020, and thus far, we have recruited over 3,000 volunteers from the 20 local governments across the state. We have trained and equipped over 25% of them with first responder kits, and the training sessions are still ongoing.
In case you witness a road traffic crash, the person is unconscious and is not breathing, please just do what we're about to do.
We have received several testimonials from our first responders who have since utilized the skills gained to improve the outcomes of emergencies that occurred around them. To further harness technology and its potential impact on pre-hospital care, the Foundation developed an emergency response application, the TCERA app suite, to connect victims of trauma with TCIF-trained first responders in the shortest possible time. This application provides users with a real-time response from specially trained first responders, as well as vital information such as hospitals, doctors nearby, health tips, etc. Alongside this was the establishment of a world-class command center to manage the operations of the application and the first responder network 12 hours daily. Indeed, the Foundation is set to do even more in collaboration with government parastatals, corporate organizations, and private sponsors, as we look forward to truly making every life count in our nation, Nigeria.
But only one triangle is right-angled triangle, because the hypotenuse of it squared is equal to the square of the two other sides. No other triangle is right-angled. No other NGO is in this business. May God give you the unction to function as a very successful NGO. Please enjoy yourselves, ladies and gentlemen.
Please, we can put our hands together for the TCIF. I think we can do a lot better than that. Come on. I mean, listening to those very, very golden words from the revered Prince Julie Delucy. Indeed, no other NGO is like the Trauma Care International Foundation because of what they are doing. At this juncture, I'd like to welcome the representative of the Honorable Commissioner for Health, Professor Akin Abayomi, who is unavoidably absent because he's all about what he knows how to do best, caring for Lagosians. And he's ably represented here today by Dr. Adeolu Arogundade. Please put your hands together for him as he comes to deliver the opening address.
The representative of the Trauma Care International Foundation, Mr. Pastor Dr. Emeka, the representative of the Permanent Secretary, Ministry of Health, Dr. Shegun Ogboye, the representative of the State Sector Command for Federal Road Safety, Mrs. Fekoya, and Director of LASAMOS, and the person of Dr. Korolo, Director of BTS, Lagos State Blood Transfusion Services, and the person of Dr. Mrs. Oshikoya. Distinguished ladies and gentlemen here present today, I stand here representing the Honorable Commissioner for Health, Professor Akin Abayomi, who is, as we have heard, is unavoidably absent, and he sends his goodwill message. I had a story. I cannot verify the veracity of the story. It says that a young healthcare provider was driving along the city of Lagos, and somewhere along the line, he became involved in a road traffic crash. And immediately the crash occurred. He moved his body. He was not dead. And then he attempted to move his head, and he observed that he had a lot of pain in the neck. And being aware of the fact that a neck injury could also mean a cervical spine injury, which could leave him paralyzed for the rest of his life. So he realized that the next appropriate thing was to cease from all kinds of movement, particularly involving his neck and his head, and then to get the proper care providers to, come and rescue him. But as he laid there trying to fiddle his phone to see if he could call 911, call 112, call Dr. Korolo's team to come to respond, a group of nearby bystanders rushed in to attempt to rescue him. And as they came near, they were going to grab him and drag him out of the vehicle, and he began to shout, "Don't touch me. Don't touch me. Call 767. Don't touch me. Call the ambulance service." Because he was fully aware that in their effort to rescue him, they were going to worsen his injuries. But the responders got there and they looked at him and said, Otiforik Bale. And they grabbed him and dragged him out by the neck. And those of us that know the potential outcome of that kind of injury. As we've heard, the greatest points when a road traffic crash occurs are the immediate minutes and hours following the incidents. And rightfully so, it's been labeled the golden hour of trauma. The first few hours that the injury has occurred. As a matter of fact, the trimodal pattern of death has been recognized in the immediate post-trauma period. It's been found that half of those that die in an accident, in a road traffic crash, half of the people that will die at the scene. They are the ones that will have smashed their head on the ground, and maybe their brain will be on the floor. They are the ones that a penetrating object will have gone through their hearts. They are the ones that if in a matter of minutes, they do not get support, they die right there. That's 50% of those that will die in a road traffic crash. Another 30% of them actually stay alive for a few more minutes, perhaps a few hours. And if the appropriate thing is not done within that few minutes, few hours, they are also counted as statistics of death. So altogether, we have the people that will die in an accident within the first few hours. 80% of them will die within that window. And then the last 20% of the people that die in a road traffic crash die a few days to a few hours. And you know why do they die? They die because the appropriate things were not done in the first few hours before the injury. It means that if in the first few hours, first few minutes of a crash, the appropriate thing is done, you will at least save the 30% that will die within the first few hours and minutes, and the 20% that will die a few days later. So half of the people that will die in a road traffic crash can actually be salvaged if the appropriate steps are taken. A little wonder WHO, as part of their Sustainable Development Goal, set an agenda to halve the number of deaths that occur from injuries by the end of last year. We're all aware that that may not have been accomplished. There have been distractions. We saw that as much as 5.8 million people die annually from injuries. 1.3 million people die annually from road traffic crashes. We see that 20 to 50 million people are injured without dying from road traffic crashes every year. And that has a lot of implication. Because we know that more than 70% of people that are involved in road traffic crashes are men within their reproductive age group. We also know that these 20 to 30 million people that are involved in road traffic crashes are also may become the source of poverty for the family. When a young man is involved in his reproductive age group, is involved in a road traffic crash, he first of all arrives at a hospital, if he does not die, where a lot of resources will be needed to even get him into the hospital and secure him care. So if there's any saving in the family, it is first of all wiped out. And a young man in the family is also probably a productive member of the family. So it means that the revenue that he also brings home is also taken away. And for the rest of his morbidity, whether it's something that he will live with for the rest of his life or not, he may be unemployable, and he may also become a drain to the rest of the resources for the family. So road traffic crashes are very significant. We also know that more than half of the people that die from road traffic crashes are the vulnerable group. So the pedestrian that stand by the road, the motorcyclist, and the cyclist, and these days we encourage cycling around as a means of improving our health. But those that are involved that are most vulnerable, more than half of the people that will be involved in these crashes are these people. We have the road traffic workers. I was speaking with the unit commander for Ikeja FRSC this morning, and they are part of the vulnerable people because they stand by the road. Every one of us, somewhere along the line in Lagos, once the traffic hits, we get out of our vehicle, try to cross the highway to beat the traffic to get to our destinations. And then we become part of that vulnerable group. So when we talk about trauma, we talk about almost inevitable deaths if we cannot prevent it. For example, in our experience at the Lagos State Accident and Emergency Center, we found that the vast majority of the people that die, more than 90% of the mortality that we record, occur from people that have trauma to the head injury, and hemorrhagic shock, irreversible shock. Now, in reversing that, you have to ask yourself, how many trauma surgeons, neurosurgeons do we have in Lagos State? And I can tell you that Lagos State probably has the highest concentration of neurosurgeons in Nigeria. And yet, if you have to get to a private hospital, you need to have something in the range of millions. So your hope is the government hospital that will not ask you for money. And then, how many neurosurgeons do we have working in this? So if there's anything we have to do, it is to, as much as possible, prevent some of these injuries. And when we don't prevent them, we need to be available to respond within the first few minutes and hours of the injury. And it was this thought that brought about the birth of the trauma emergency rooms across the state, ours being the flagship. And it was this thought also that brought about the states bringing last ambos and retooling them to serve these purposes. And up until now, they have done a great job. But there's just so much that they can do all by themselves. And so recently, government has also co-opted the LASEMA response unit to support in managing emergencies that occur on our highways. And then we have a whole host of other activities. But it's wonderful to observe that the Trauma Care Foundation International has taken the bold step, and like we have had, they are unlike any other. They have not only begun to train the common citizen in responding to trauma, to responding to injuries on our highways, in responding to other emergencies, but they have also put their mouth where their money is, or put their money where their mouth is, by arranging for blood. If you remember that I said that one of the common causes of death in trauma injuries is hemorrhagic shock. The patient bleeds away. And what else can you do other than to make blood readily available? So it is with excitement that the Commissioner expresses his gratitude to this organization for all their efforts in ensuring that the lives of Lagosians are preserved and that trauma care receives appropriate attention in the state. We've always known that the government cannot do it all. And in recent times, we began partnerships, but no partnership has been like the partnership with the Trauma Care International Foundation. And on behalf of the governor, the Honorable Commissioner for Health, I want to appreciate your efforts. Thank you for what you are doing. The TCERA app is long overdue. I'm aware that LASAMOS has a project that is similar to that going on, and I'm also aware that LRU has been working on something. But how much more effect we will have when we collaborate and we don't leave everything to the hands of governor like the Trauma Care International Foundation is doing. I can tell you this. Yes, nobody may get it right at the first time. But when you started in 2012 to delve into emergency care in Lagos State, this is not where we were then. The care for trauma victims in Lagos was not here. 5 years ago, you had trained quite a number of people, but we're still not here. But today, we have introduced the TCERA app, and we are still not there. And I can imagine where we will be in 5 years if we continue to grow as we are doing so. I can imagine how many lives will be saved that would have been dead when we continue to grow and work together in partnership like we are doing now. So on behalf of the governor, I keep saying the governor, the Honorable Commissioner, I want to appreciate you. I also want to appreciate everybody that has taken time out to be here today. It speaks to one thing. You care about the lives that are lost on our roads. We heard that our country accounts for the highest number of deaths on the roads. It's interesting to note that 60% of the vehicles in the world reside in the low and medium income countries of which we are chief. But 93% of deaths that occur from road traffic crashes happen with us, while we only account for 60% of the vehicles. How come that we that don't have all the vehicles are the ones accounting for most of the crashes? But the fact that you are here today shows that you are concerned and you will want to see a change in this. I want to appreciate everybody that is present, lending your support to the TCERA app and the efforts of the TCIF. We want to thank you and want to encourage you to continue to put your support in hand. And for the Trauma Care International Foundation, we cannot thank you enough. We cannot appreciate your support, your continued support and commitment to the saving of lives in our city. We know, and we know that you also know, that God is a rewarder, and He will surely reward you. Thank you very much, and God bless everybody here.
Trauma Care International Foundation is an award-winning registered non-governmental organization which attained special consultative status with the United Nations Economic and Social Council since 2019. Driven by our vision to improve the state of trauma care and emergency response services in Nigeria and our other member nations, the Trauma Care International Foundation First Responders Network was born. It is a special initiative designed to provide trauma victims with emergency care within 10 minutes of injury. This life-saving feat will be achieved through our network of skilled and trained volunteers who will provide prompt, fast, free emergency response services to trauma victims in their locality. Trauma in our environment has been associated with very dire statistics. Every hour, 2 people die. Each day, no less than 14 deaths are recorded. And every month, over 400 lives are lost as a result of traumatic injuries. In a medical emergency, every minute counts in getting that vital first medical support to the patient as quickly as possible. Those first golden minutes can make all the difference to a patient's life. That's why our team of volunteers will be available to save lives as they deliver vital immediate care to their neighbors in those critical first moments before the arrival of the ambulance service. You can make a difference with us in 3 simple ways. Sign up as a volunteer by visiting www.traumacareinternational.org, sponsor an emergency response team, adopt a community. For more information on how to be a part of us, kindly call these numbers now showing on your screen. Trauma Care International Foundation. Every life counts.
Let's put our hands together for Trauma Care International Foundation. You know, so much has been said about the amazing impact of this NGO within a few years that it has been around. I just got words that the Trauma Care International Foundation First Responder Network in Lagos has over 3,000 first responders in their network. I didn't hear your applause. Well, come on. That is amazing. Why is it important? You never can tell whose life will be saved. It could be the life of the person that will discover maybe something that will change their lives. Who knows? Maybe the future governor of the state. Maybe a senator that will make a difference. Maybe a medical doctor in the making that will save even many more lives. That life will be saved at that point. So thank you so much, Trauma Care International Foundation, for the amazing work you're doing. And I also learned that the first full trauma center is going to be constructed by the Trauma Care International Foundation. Not anywhere in the country do we have that. It's going to be a state-of-the-art one, the best in the world, and Trauma Care International Foundation is blazing that trail yet again. Thank you for your many firsts, even as we celebrate the launch of the TCERA user app. I'm so excited about it because this is one app that is going to be available to just everybody. Anybody can use it. The responders have theirs, and those of us who need the help, we're going to have ours. So from wherever I am, imagine if that doctor, you know, a moving story you told, sir, if that doctor had this app and he could just launch it at that time, help would come. Or someone who knew, who saw it happen, could have launched that app, post that information, and help would come. But we are sure there are many more that we can save their lives as we go forward. The next on the agenda is a discussion, a panel session to discuss the role of technology and e-health platforms in emergency response services in Nigeria, using Lagos as a case study. We have distinguished panelists, and this segment will be moderated by the esteemed Dr. Olajumoke Akisoya, a Senior Executive Officer with the Trauma Care International Foundation. Please join me and welcome her. And then we also welcome other panelists as she would introduce them. Please let me welcome the moderator, Dr. Olajumoke Akisoya, Senior Executive Officer, Trauma Care International Foundation.
Thank you very much. And I use the opportunity to once again show our appreciation for you taking time to be at this event where we are able to introduce and launch our first responder network, our volunteer first responder network, and also the apps that volunteers all over Lagos can take advantage of. This discussion is titled The Role of Technology and E-Health Platforms in Emergency Response Services in Nigeria, using Lagos as a case study. And this expert panel of speakers will highlight areas of improvement in delivering pre-hospital care for traumatic injuries, while commenting on the role of technology and its potential impact on emergency response services. Secondly, the role of government in collaborating with pre-hospital care platforms. And thirdly, the need for community education of trauma management and resuscitation skills. So join me to please welcome Dr. O.A. Kola Korolo, Director of Lasambos. You're welcome, sir. Yes, please. I have the highly esteemed Dr. Adeolu Arogundade, of the Medical Director, Lagos State Accident and Emergency Center, Old Tollgate, Alausa. You're welcome, sir. And joining us, so that it's balanced, we have the representative of of the Lagos State Sector Commander of the Federal Road Safety Corps, in the person of Mr. Olusegun Ogungbemide, represented by Mrs. Emma Fekoya. You are welcome, ma. So you can see I have able, qualified panelists to help us, on not those three agendas that I earlier mentioned. So right away, I'm going to ask Dr. Korolo the first question. Using Lagos as a reference point, how well will you say we have done in emergency response services over the past 5 to 10 years, knowing that Lagos has been the center of excellence and showing the path for other states in the nation?
Thank you very much, Dr. Akisoya. It's a pleasure to be here. And I think I want to appreciate TCIF for championing in the relay race, because I take it as a relay race, and they are starting the race. It's a team effort. Yes. There are so many stakeholders involved, and we're going to pass the baton at the appropriate time to the various stakeholders, I'm sure. So on this note, I want to thank Trauma Care for putting this package together. The TCERA app is a novel innovation in the States as we speak. And it's the first, if we're to appreciate that, even though there are other stakeholders who are working, in the background scene.
I think we should give Trauma Care International Foundation a round of applause. It's the first.
So,
thank you.
I'm glad that you appreciate the enormity
Yes.
of what needs to be done in the space of emergency response service in a state that the population is as thick as what we see daily.
Yes.
To put it in proper perspective, we also should appreciate the state government for starting an emergency service of this nature, I mean the Lagos State Ambulance Service, as far back as 21 years ago.
Yes.
It will be, right to appreciate the government in this wise because it was one of the, innovations that was necessary to fulfill, the MDGs then for a state like Lagos State. And we've been down this road for about 20, 21 years. It has not been easy. The investment has been huge, both from the public and private sector, of which TCIF came on board 2012.
Yes.
We've had good handshake with TCIF, even by way of even donating ambulances to us as far back as some, 15 years ago, if I'm correct. So the road has been a long one. But the state government, with its partners, have done quite a lot. My brother here, Dr. Arugundadi, mentioned in 2010, there was a plan to establish trauma centers across the state, of which his is a pioneer trauma center, facility. And as we speak now, some of the innovations we put in place, both the private, both government and non-governmental, you appreciate that is addressing some of the SDG goals.
Yes.
If we're to talk about the Sustainable Development Goals, 3, 9, 11, and 17. So we've done a lot as a state. Lagos State Ambulance Service was established, like I said, 20 years ago, 21 years ago, and we didn't start with a lot of, policy, the government didn't have a good policy, as let me put it that way, or a strategy. But they just thought of the need that it was an everyday occurrence that we see accidents occur, collapsed buildings occur, and people are moved in all sorts of, manner, increasing morbidity and mortality, and outcomes for even injuries that should not have any lasting effect on the patients. So in this wise, the state government has gradually, improved the capacity of the Lagos State Ambulance Service. We started out with 5 ambulance points, and as we speak today, we have about 25 ambulance points across the state, with a plan to have at least 1 in each of the LGAs. There are some LGAs that have about 2 ambulance points, but the plan currently with this administration is to scale up to 57, to have 1 in each LCDA. Yes. Now, if we put that together with what Trauma Care International Foundation is doing, it is increasing the network to the grassroots.
Yes.
We all appreciate that. So the closer we get the service to the grassroots, the quicker it is to deliver proper service, proper care to the would-be victims. Also, I want to mention that trauma does not give any, notice. Most health, events will usually start and escalate and get to a crescendo. But trauma does not give you any notice. Now, for this reason, we need to establish, those services that will prevent the worsening of, outcomes for the victims. We have a number of partnerships we've engaged over the last 5-10 years To bring it home, about around 2012, when Trauma Care International Foundation came on board, it was thought out that Las Ambos there should be a turnaround for Las Ambos, and a lot of things were looked at. I remember Shell Nigeria Exploration Production Company was brought on board to look at some of our processes and improve our documentation. And also TCIF came on board. We have partnership with a non-governmental organization in Texas. We have one with a Canadian organization. So about 6 of them are existing. And the government has also increased the human resource funding, in the last 5-10 years. To also mention the last 5 years, technology has been in the forefront burner, and the Office of Transformation and Innovation with LASEMA, as Dr. Arugundade mentioned, and Las Ambos is working on some novel innovation, of course, for which TCIF has bailed the cat now. And in due course, all this will be rolled out. Thank you very much.
Thank you. Thank you very much. He has rightly spoken that for the vision that we have concerning the emergency response app that we are introducing and launching to the public today, it's as a result of wanting to get to the grassroots, the everyday person. First and foremost, ensuring we have people interested in attending to emergencies rather than be bystanders, being able to effectively, administrate the right first aid skill in any emergency situation. And that is the root of the first responder network. We thought that the state government has been doing a lot, but when you think about the population of Lagos, you know that there is a lot to be done. And we have 57 local council development area in Lagos. And what we are doing in our first responder network is to ensure we have a good number of people in each of these LCDAs, so that it could happen in the market. It could be a school that an emergency will occur. Someone somewhere that is a TCIF First Responder trained individual, that is a trained volunteer, will be able to do it. And in a way, the partnership is such as taking advantage of the goodwill of Lagosians. Hardly will you find someone in Lagos that is not willing to help. But sometimes the issue is they don't know how to go about the help. So what the NGO is doing is reaching the everyday people with the right training on what they should do or what they can do when an emergency occurs. And that way, the time lapse between getting help is shortened, and it makes survival better. Right. Now, we're going to go to the next person, in the person of esteemed Dr. Adeolu Arugundade. The question is, in a world that is fast evolving technologically, what is the role of the technology? What is the role of technology in the delivery of pre-hospital care? And in what ways can we make it better, considering the current milestones Lagos State have achieved so far?
Okay, thank you very much for that question. I believe strongly that technology has a significant role in addressing pre-hospital care all over the world, not just Nigeria. And there's a lot of examples to learn from. I was in Luxembourg or thereabout, somewhere in Europe, some time ago, as far back as about 10 years ago. And I became aware of this using wearable technology. An organization we're trying to work with had this technology that they got a bracelet for elderly women who live alone in their homes. They wear the bracelets, and the bracelets has gyroscopes, accelerometers, all of those technology embedded into it. So if the woman was to take a fall in her house, on her way to the bathroom, coming out of the bathroom, they tell her, don't get up, don't even move, just stay there. The bracelet calculates what happened, determines if it was a fall, just a simple bracelet in her wrist, determines if it was a fall, and sends a distress call to the nearest ambulance. And the ambulance time was 3 minutes. So they tell her, don't get up, just stay there. If you fall, stay there. In 3 minutes, an ambulance is coming to somebody, a provider is coming to you. Mm-hmm. And when I heard that, it literally blew my mind back then. And I began to see the possibilities that technology could bring in saving lives, particularly in emergencies. And so I'm really pleased to hear some of the things that have been said. I'm aware of a lot of work that is also going on. I also know about a number of apps. For example, there's one that allows you to locate blood service for emergencies. There have been ones that have been involved in that allow you to identify the nearest care provider, a hospital, say, for example, and what capacity of service they're able to deliver. Yeah. So without doubt, technology has a lot of role to play. When I became the medical director at the or even before then, way before then, when the Lagos State Accident and Emergency started, I decided to put the hospital on the map. So I created on Google Maps the location of the hospital and some other parameters. And from that time onward, every month I received a message that tells me how many people Googled emergency in Lagos State. How many people called, and we were receiving phone calls. On an average month, we got over 3,000 search for emergency in Lagos State. And they were all directed to our hospital. We got over, on a daily basis, we were getting like 5 phone calls, averagely asking for how to get to the hospital. Some emergencies were not even related to us, but as of that time, and I believe it's still like that right now, if you Google emergency on your phone, it landed you in our hospital and gave you direction to where we were. So I realized that these things actually can provide service. And I believe that I shared that information with Lasambos and other stakeholders, and it's helped in directing our focus, in pointing us in the direction of how to reach the people that we need to talk to. The last time we were sharing that information, we were talking about web scraping, crowdsourcing freely available information on the internet to identify, locate locations of incidences at accidents and emergencies. You know, all of this technology helps to improve access to care. We've also heard about the technology used in Rwanda, where drones are used to deliver blood because to not easily accessible parts of the city or states. And all of that is what technology can do. And I believe that the TCERA app is just built a cat like we have had, and that we have a lot more. And so I'm personally excited, and I look forward to a lot of things happening.
Thank you so much. Thank you very much. And, you know, using the opportunity to talk about the other features that are in the app. On the app, you will have the list of the nearest hospital. On the app, there is a list of the nearest doctors. On the app, which is something Trauma Care International Foundation is championing, are the list of places, institutions, hospitals, where we have the AEDs, that is the automated external defibrillators. We are actually championing for more of it to be in common marketplace, hotels. We are advocating for that policy where the marketplace, the malls, the schools, where there is large gathering, for us at least to start with that and have the automated external defibrillators. But on the app, we are on it is recorded the hospitals in Lagos that have the AEDs. Also on the app, we have nearest hospital, nearest, and the hospitals are not just there. it is through HEFEMA. We ensure they are registered, they are on good standing and all that. So we've done our due diligence to ensure that the right content in the app are accurate, and we keep updating as we go by. If there's any falling out with HEFEMA, of course, the person has to go off the app. And same thing with the Medical and Dental Council of Nigeria concerning the doctors nearby and ambulance services nearby. So I just wanted to chip that in because of some of the features that you mentioned should be available. Thank you so much, Doctor. Now I go to the esteemed representative of the Lagos State Sector Commander, Mrs. Fekoya. The question we have is that the impact of the Federal Road Safety Corps has been extensive, in their contribution to patient evacuation, as they often interact, with individuals affected by road traffic accidents. How can the use of technology multiply this impact?
Thank you very much. Thank you very much. Let me use the opportunity to congratulate Trauma Care International Foundation for this feat that they have achieved. I know we are getting closer to attaining level of professionalism and making things easier for every one of us. The FRSC, on our own parts, we have a mandate of eradicating road traffic crash and creating a safe motoring environment. And to eradicate road traffic crash, you need to educate people. That's from the preventive angle, because you need to prevent things happening. And so we focus on a lot of public enlightenment, educating people. And then along the way, when these things happen, because you cannot rule it out, the crashes occur and our attentions are called for us to be there, available to ensure that everything goes on well. We rely on technology to do this. We have what we call the first information report, and that is communicating. We have the call center that has a platform where we connect with all the commands. The code of the emergency line is 122. Once you call all over Nigeria, it is connected with all the commands in Nigeria, wherever the crash occurs, bringing down to Lagos State, where we have 12 commands and 5 outposts. The call center calls whichever command is nearest to the place of crash, and they proceed there. On getting there, if it depends on what they meet, we also have connectivity with hospitals, we'll have connectivity with other agencies. And then we get telling them of the situation on ground, about what happened or what they met, and from there. Then we also have the CUG also, the closed user group, where we connect with ourselves. Maybe there's a call or we have an information, we call the next command, who takes up the effect. And if it's something that has to do with gridlock, because we experience gridlock during emergencies, by the time you communicate with the other command, telling them that we have issues on ground, please release your men to help clear the road. And in doing this, our synergies with other agencies outside ourselves. We relate with LASMA, we relate with the hospitals themselves. We have a communication line as regards that. So that's for the first information report. We also have the GPS. And there it's in the headquarters. Once the call goes through, the 122, whoever is called, your vehicle is monitored from headquarters. Because we are expected to get to the rescue scene in 10 minutes. So once the call goes through, you are being monitored from headquarters to see if you comply with directives. So we use the technology of the GPS also as well to reach out to making sure that the people are rescued and evacuated from the scene. Then managing hospitals, we have connectivity with all hospitals. There's a mandate that we should have a link with every hospital closest to all the 12 commands. Like for me, I have for Lasut, I have for Lut. Once we have cases of crash, we communicate with the appropriate authority, who will also inform them of what we have on ground so that they get prepared for what's to come. And on that basis, because we know that hospitals also link up with themselves. We've had cases where we've taken patients to hospitals and they just give the first aid because it's above them, make reference to another hospital, and we jointly move such victims to them. So technology cannot be, it's advancing, it's growing, it's coming up, and I'm grateful for this one that is here today that we are going to launch, and I know that it's going to take us a step higher. Then also public source information. We have issues where people maybe are on ground, right where the scene occurs, and they put it on social media. It gets to us, we respond, and then we also call appropriately the people involved to move to those areas, and like I said earlier on, synergizing with other agencies, because you can't do it alone. The task is awesome. The task is enormous. We can only achieve great results if we synergize to do it. Also in resource allocation, sometimes you don't have enough resources to tackle the issue. We call appropriately. So communication is the key in here. Communication, data analysis, and security are of utmost importance in the preparedness and prevention of crashes. And technology can only be the one to help us out, communicate well, collate data rightly, and ensure that we achieve our aim. Thank you very much.
Thank you so much. Thank you for that enlightening discourse. I like a last word. I would like Dr. Korolo and then Dr. Arogundade to highlight as a summary the collaboration that can go on between the private and public sector, especially in the area of pre-hospital care for emergencies. Yes.
Thank you very much. Thank you very much, Dr. Akisanya. Well, we've started the play already. TCIF, with the training of their first responders, the launch of this app, where we know very well that, as my fellow colleague from the FRIC mentioned, communication is key. Your TCERA app will provide a medium for escalating communication or information to, for help, so where it's required. So collaboration between both private, non-governmental and governmental, sectors is very important. Mm-hmm. Like I said earlier, even though the state government started, what looks like an emergency service in 2001, going down the road up to now and beyond, we know we've gone past how we started. If we look back how we started, it looks like, when we were in the dark ages, But now, with all this deployment of technology, information gateway, getting speedy across to where help is required, and from those who require the help as well. And the training of the grassroots people so that they know what to do and they know their limit is very important. Like if we are to appreciate, the enormity of what needs to be done, we have about 28 government facilities and over 3,000 registered private health facilities in a population where we have over 24 million people. Road crashes every day. 1 out of every 3 cases or 4 cases that come to the hospital is a trauma event. Mm-hmm. There's a lot to be. This app, the call center, the command and control center, which the Lagos State government established in 2010, all increases the access to care. So with this app, we should expect that a lot needs to be done at the post-crash, area. So there's still room for a lot of collaboration between both governmental and non-governmental, organizations. Thank you very much.
Thank you very much. Thank you. Dr. Arogigade, your last words.
Thank you very much. I should add that one of the biggest things that government did in tackling pre-hospital care for trauma emergency victims is setting up the call center, because it means that then you can reach out for help. And then setting up the ambulance service to respond to the calls. And that was one stage, and that was one step. What TCERA has done is to take that step to another level by identifying a network of first responders and facilities where patients can be taken to for care. I know very well one of the challenges that Lasambos has had up until now has been being able to find the appropriate hospital with the appropriate manpower for the situation that the victim has at hand. But an app that is able to filter and sequester what nearest facility can provide the care goes a long way in stepping that up. And that is what TCERA means. And if we can identify these groups and train them appropriately to respond appropriately, we have taken another step forward in minimizing the fatalities and morbidities that result from road traffic crashes. And that's also one of the things that TCIF is doing, which is also applaudable. The next thing will be to identify which centers are able to provide the appropriate care. And that is also one of the things I understand that you just mentioned, that you are building a world-class trauma center. So in all of this, it underscores the impact of the private sector working with government. The government has set up 27 general hospitals, including a tertiary hospital. The federal government has Luth there with also an appropriate emergency room. But with all of that, the population of Lagos continues to grow. I understand that we have close to 26 million people in Lagos State. So then ask yourself, how much care can Lasambos alone provide? How much care can the 26 general hospitals provide? We definitely need the support of the private sector to continue to save our people. And that is what I believe that Trauma Care International Foundation is advancing. And my last word would be to encourage us to continue to grow like this. You see, again, I believe that nobody gets it right the first time. But iteratively over the years, taking the right steps forward, we will eventually get to the promised land. So if you are here, I encourage you. If you are in the network, please be encouraged. There might be days that you feel discouraged ahead, but for every day that you are there, it's the confidence that somebody is going to be able to get back to their family when the day's work is done. Thank you very much.
Thank you very much. Thank you. Thank you to, yes, Mrs. Fekoya.
Okay, please, like I said, FRSC has a mandate to eradicate road traffic crashes. And our emphasis is, as much as possible, let us help reduce those crashes. So it gives less problems on ground. And that's why we do a lot of educating. And I want to use the opportunity here because that is part of my job. We are all road users. And a lot of us do not know how to use the road, which is very important. Most of us, we use the road because we don't want to avoid being arrested. Enforcement is part of it. Enforcement is like discipline, ensuring that you do what is right to avoid a crash. And that's why we are there on the road. Please, we want to encourage you. Road safety is everybody's responsibility. Everybody's responsibility. If you do what is right, I do what is right. We are all on the road. We share our responsibilities. We share our lanes. We look out for each other. There'll be less crashes. And there'll be less money spent on building institutions to take care of us. The simple rules that are there, The facts have stated it. Researchers says the human factor is the one majorly responsible for road traffic crashes. That's about 90%. And that's about me and you. And we have this thing of attitude and ignorance. Ignorance because a lot of us are ignorant on how to use the road. A simple fact, the simplest fact is, how do you walk a child on the road? A lot of us are ignorant about it. You see most people putting the children towards the side of traffic and keeping them at a safer distance. As little as that, if anything happens, somebody misses or out of loss of concentration or whatever, hits that child, then we have something else on our hands too. And so that's ignorance. And so many things about ignorance on the use of the road. Then we go on to attitude. You know what is right, but you will not do it. Now we complain. The government has not done this, has not built this infrastructure, and the rest of it. The pedestrian crossing has been put in place. How many of us use it? We would rather take the risk of running across the road and constituting a nuisance, a likelihood of a crash. And then you have, rather than get into the issue of crashes, why don't we avoid it? It's a collective responsibility. When we all decide that I step outside that road, I use it correctly. Where I'm ignorant of it, I get educated about it. And that's why we use every platform. We use the media. We use forums. We use your community meetings, your local government meetings, any platform, because we want to ensure that we stop the crashes. We use all these platforms to educate you. Some look at it as they are unnecessary. There are some people who don't listen to radio. They don't listen to television. They don't have that time. But we will meet them in the religious institutions. We will meet them in the markets. We will meet them in their local places, and we talk to them. And I also want to use this opportunity. Please, if you have a platform where you invite us to come, we will come gladly. As long as we ensure that everyone is educated on the use of the road to stop these crashes. So rather than spend money on building institutions to take care of us, let's also encourage ourselves to invest our money in other places. Thank you very much.
Thank you. Thank you so much. Thank you.
Please permit me to say.
Thank you for that.
Sorry. I want to really appreciate TCIF for also bringing up the first with the planned establishment of the Trauma Care Center. I think it appreciates, the TCIF team appreciates the full circle of what it takes to respond to an emergency, situation. It's not just creating an app. It's not just training the first responders, but post-crash, what happens? This has been the bane of challenges we face. Like my colleague mentioned, 27 to 28 secondary facilities and 3,000 registered private health institutions. It cannot be enough. And not all of them are operating emergency centers. So we're going to take this back home between me and my colleague to tell the Honorable Commissioner for Health and the PAMSEC that, the recognition should be, better than what it is now in what TCIF is doing in this space. Thank you.
Thank you very much. Thank you. Let's give a round of applause to our able panelists. And just to have a kind of roundup of what we are doing here, first and foremost, I want to encourage everyone here, be willing to be your neighbor's keeper. The first aid skill that you learn is not necessarily for you. It's for you to be able to help someone else that may be in need. And I want to encourage us, the TCI First Responder Network is a volunteer network. It's non-remunerating, it's everyone's free will. And we've had, like we said, more than 3,000 Lagosians that have said, I want to be trained, and I pledge to offer help to the extent of the knowledge I have been imparted, which is just the basic first aid. And one thing about our volunteer first responders, they know where they shouldn't go. They know their limit. They are not all medical certified, like they are not doctors, they are not nurses, they are not paramedics. They know their limits, they know where to stop. And one thing about it is that if nothing else, they know how to call for help in a very effective manner than every other person that may be running up and down. They know the right channel to bring help to the person. And with the use of the app, we are going to communities and we are going to collaborate with the LCDAs. We are going to collaborate with the government the structures that the government has put in place. We have estates here and there. It is training key people in those estates, deploying the app. They form a community by themselves. And most estates, you'll probably find a clinic, you'll find a school, so we are forming a consortium to kind of get to the people that really need the help so that help gets to them on time. There are many more things that we are going to collaborate with the Lagos State government. There are many more offering of things that are in the works to make pre-hospital care more effective. And I must commend the Lagos State government. Like I said, this is a center of excellence, and hardly is there any state that has the structure that has been built over the past few years. And I want us to please recognize the efforts of the Lagos State government in our health sector. Thank you so much, and I will encourage us, spread the word. Tell people to download the TCERA app. The user app especially, it's on Google Play Store, it's on iOS Play Store. So please ensure you download and spread the word. We are going to have more formative collaboration with the Lagos State government because of the different platforms that we need to consolidate on to make sure the everyday people get the help that they need. Let me confess to you, one of the major reasons why we did this app was the congestion on our Lagos roads. We had to solve that problem. That was one of the reasons why we thought, you know what, we have volunteers in different parts of the state. That market woman that we trained yesterday, the conductor, the vulcanizer, like you said, we actually pinpointed people that will be at the scene of an emergency that were not medical people. The vulcanizer is by the road. Is going to have access to the road accident, The petrol attendant is probably going to be on the highway. So we strategically were picking people in everyday life. And we thought that, they could be the nearest person before the ambulance gets there. That was why we thought volunteers in our communities may be the solution to our vast health emergency issues, because when we don't get to them on time, that is when the fatality or the morbidity is worsened. But if that market woman that was trained, someone collapsed in the market, the person quickly gets to that person, even before the ambulance, with every good intention, but gridlock on the roads are not allowing the first responders to get to the scene of the accident. So we had to look at it that our volunteers everywhere can actually be a solution. Let us activate them, and that was why we networked the different volunteers we have trained over time, and the training is ongoing. We are in collaboration with FRSA, with Lassa Boss, and many others. The training is ongoing because of the passion that our chairperson, Pastor Dr. Diola Phillips, has concerning pre-hospital care and trauma management in Lagos. So with that, I want to say thank you, Ma, for the opportunity to have represented you in this August occasion. And I want to thank everyone that has been here. Thank you, my panelists. The next thing we are going to have to do now, which I'll hand over to the MC, is the unveiling of the app. Thank you so much. Thank you. God bless you.
It's big. It's life-saving. It's going to be a game changer for emergency care in Nigeria. The TCERA application is here. The Trauma Care International Foundation Emergency Response Application has been built to connect people in the event of an emergency to TCIF First Responders, who will provide first aid and emergency first response within minutes of activation. Get started with these 6 simple steps. 1. Download the TCERA user app on the Google Play Store and launch the app. 2. Sign up and fill in the required details. Upon completion, a one-time password will be sent to your registered mail and phone number. 3. Log in with your one-time password. 4. Edit your profile and update your health information. 5. In the event of an emergency, click on the SOS button. 6. Provide details of the emergency, and the TCIF First Responder closest to you will arrive within minutes. It's that simple. Thank you.
Thank you very much. Can we put our hands together for TCIF again? You know, just to think of what we are doing here today, it has also positioned our country, Nigeria, on the map of nations that are taking advantage of technology to improve healthcare in our society. Thank you to TCIF for positioning Nigeria. Before we get on the unveiling of the TCERA apps, I said apps because there are actually two. One is for the responder and the other for the user. So I'd like to quickly recognize Dr. Chinyere Gift Okore, the head, Grant Management Office, representing the Director of Healthcare Planning, Research and Statistics. Please, where is she? Please, we are happy to see you. We have been waiting for you. Good to have you here. And also representatives of the Chris Oyakilome Foundation International. We have Pastor Rhoda Olishino, Pastor Larry Famodu. You know, all that you see the TCIF do, I want you to know that they are doing it because they have support from a lot of donor and partner agencies. And we want to especially thank the patron of the Trauma Care International Foundation, Reverend Dr. Chris Oyakilome, for inspiring this initiative and supporting them. You know, you can inspire an initiative and leave them to go try. But to inspire an initiative and go ahead to support them to do all the beautiful things they are doing is just amazing, extraordinary, and I want us to put our hands together for them again. I also want to recognize Eze Ogochukwu Joy. If I got this, Menis Consulting, SSM 8 EDC. Okay, who is that? Okay. You understood what I was saying. Beautiful. Thank you very much. At this juncture, I'd like to quickly welcome the representative of the Honorable Commissioner for Health, who has been very, very gracious with his wealth of experience. You've shared a lot of thoughts with us today that has really opened our minds to a lot about trauma issues in Nigeria. The esteemed Dr. Adeolu Arongudade to please come forward. Let's also welcome the esteemed representative of the chairperson of the Trauma Care International Foundation, Pastor Dr. Emeka Eze. Put our hands together for him. Let's also welcome the representative of the Lagos Sector Commander of the FRSC, who has told us today, I think we can try and minimize the accidents so that we can use the money for other things. Thank you very much. That was a very strong appeal. And of course, the director of Lasambos. Please put your hands together for him. Let's welcome the Senior Executive Officer of the Trauma Care International Foundation, who is going to take us through this unveiling. Again, Dr. Olajumoke Akisoyan.
Thank you very much. So I'll like us to please kindly proceed to the right side of the stage. The esteemed representative of the chairman of Trauma Care International Foundation, will lead the cutting of the veil.
Okay, so we, at this point, we have, okay, yes. So first is the user app.
Thank you very much. Can I have better sound? Okay. Thank you very much. On behalf of the patron of this organization, Reverend Dr. Chris Oyakhilome, the chairperson of the Trauma Care International Foundation, Pastor Dr. Diola Phillips, who is also the director of the Healing School, who is unavoidably absent, and in collaboration with a very powerful team from the Lagos State government, ably represented, I want to launch the Trauma Care Emergency Response application. The user app, this is the part that is used by those in the general public to be able to alert on behalf of themselves or anybody that they see having an emergency of whatever sort. My hand is going to represent every hand here, but I acknowledge all that you do. And of course, the app is going to actually encompass all these agencies because we are going to be working together in tandem. So permit me to cut this tape. I'm quite able to officially launch this first of its kind in Africa technological solution to quick response at any point in time within the Lagos metropolis. Congratulations. And of course, you can see a prototype of the page. And like esteemed Pastor Jumoke already, Dr. Jumoke already explained, everywhere in Lagos, we have volunteers stationed. And so once the app is launched, within a few minutes, somebody can show up. Do I move on to the next one?
Yeah, no, I will actually want Dr. Olajumoke to throw more light into this user app, and then Dr. Adeolu Arogundade would be cutting and unveiling the responder app.
Okay, thank you very much.
Thank you very much. And I'm very delighted to introduce us to the Trauma Care Emergency Response app. This is the user app. This is what is available for everybody. They can download it. And like the representative of our chairperson already said, you use it not just for you, but somebody else. You may find an emergency on the way and you are looking for the nearest first responder around. One thing we always educate people, even as we are doing the campaign, is for them to first and foremost know the Lagos State Emergency Line, 767. You should not forget it. While that is going on, we now say, talk about the app, because peradventure, there may be a first responder in your community. While you have initiated the Lagos State structure, peradventure, somebody may be around that knows first aid. So you definitely have to call and press the SOS button. You can see it there. And even there, you will be able to see yourself where you are on the app. And once a responder accepts to take your emergency, you will see the location of the responder relative to you. And the responder is able to chat you up immediately to say, where are you? What is happening? Are we together? And through that, the responder also has a map and is able to locate the person that has the emergency. The responder can call, video chat, so you can actually see the person. and be able to tell them what to do even before you get there, because you can video chat the person, you can call the person, or you can just simply chat up with the person. And usually, I want you to know that it is not all the time that we open the app because of emergencies. We actually have other features inside. It could be that you want to see a dentist, you want to check, you can look for doctors around you or hospitals nearby. Also, we have health information. We are all about healthy living. It's something like exercise. There are information about healthy eating on the app. So, and there are always new articles every week. So the app is not just when you need an emergency. The app is actually a source of motivation, information, and you'll be able to kind of spot around what is happening. So the user app is for everyone. Thank you very much. So we go next to the next unveiling, which is the TCERA Responder app. Let me give us a quick brief about the Responder app. The Responder app, even though it's available on Google Play Store and the iOS, cannot be activated by anyone for security reasons. The only people that have access to the Responder app are those that we have certified, those that we have recruited, those that we have trained, those that we have confirmed. Are we together? They have the access code to it, and they are the only ones that can be our responders. And one thing about it is that we've put in measure for customer interrelation. Someone that the responder takes their emergency can rate the responder, whether the responder was rude or the responder was excellent or the response. So the responders are striving to keep their 5-star rating at every point in time. When they attend to the person, they have to be courteous. When they attend to the person, they have to be professional. When they attend to the person, they have to be communicating. So all those things matter. In the user app, the user can rate the responder and say, this responder was excellent, or this responder. Of course, that is after the emergency. We give the opportunity for you to rate the responder. So the responders know that they have to do a lot for that right standing. And if any responder is found to be below par, our standard, we deactivate immediately. Even if the person still has the app, the person cannot respond to any emergency. So that's what we have done. So I just wanted to bring that in. And the responder has a lot of features. The responder app responds to the emergency, gets notification that there's an emergency nearby, and the person is able to respond. Now, once the person responds, on arrival at the scene, he presses a button and it tells us that, oh, you are at the scene. At the back end, we are monitoring to be sure that has this emergency been attended to or not. If the responder does not get there on time, we second another first responder nearby. So it's an ongoing communication until the emergency crisis is resolved. So, and like we said, our vision is to have as many volunteer first responders in each LCDA such that emergencies are responded to in less than 3 minutes. We are going to get there. We are building up to it. We are building up to it because the population of Lagos is enormous. But with the collaboration, more and more people will become trained and they will be available to take emergencies. Remember, the idea behind it was to limit the congestion that prevents our abled ambulance services to get to the root of the problem. And everyday people, some of them ride bicycles, some of them are on motorbikes. They can get to the scene even before our ambulances can get there. So that is, in simple terms, the vision behind what we are doing. Lesser time to attend to emergencies, increased rate of survival, less mortality, less morbidity. Thank you so much. So, Dr. Arugade.
Thank you very much. That was wonderful. So I tell people that if you do basic life support, BLS, you quickly notice that whatever it is that you are taught or you are trained to do, You cannot perform it on yourself. And since an average person, well, I believe I'm average. I spend most of my time in the office, at home, in church, and on the road. So it's in my best interest if I'm going to have a, God forbid, if anyone's going to have a cardiac arrest or an emergency like that, you'll probably be at home, at work, in church or mosque, or on the road. So it's in your best interest that the people that are at these areas also know BLS. They're also trained. So that, God forbid, you collapse at home. Somebody in the house can attempt to resuscitate you. So similarly, if you are here and you have this app, it's in your best interest to co-opt the people in your community to become responders and to enlarge the network. It may sound selfish, but it also means that in your community, you'll have more responders that can respond to the emergencies you have and the emergencies your loved one have. All right, so on behalf of the Honorable Commissioner for Health, Professor Akin Abayomi, who represents the Lagos State people, the Lagos State government, and the good people of Lagos State, I declare the app launched in the name of the Father, and of the Son, and of the Holy Ghost. Thank you very much.
Thank you very much. Just a quick one. We can have a quick photo shoot, and then we can go into the next, which is the special segment on collaboration with Lasambos. So while we get ready for that, let's have a quick photo. I'd like at this point to welcome Dr. Amaka Adekoya to take us through the special segment on collaboration with Lasambos.
Good afternoon, everybody. It's a privilege to be here. On the Trauma Care International Foundation, as part of what was mentioned in our speeches, of course, all protocols duly observed, we've gotten into strategic partnerships with key organizations, and one of them is the Lagos State Ambulance Service, Lasambos for short. So today we have a few of the beneficiaries of that special program through which we're providing basic life support training to those that we know are already pre-existing first responders so that they are better equipped, re-equipped, and further enabled to do what they are already doing. So I just want to specially recognize some of our trainees. Would you mind waving to me? Very good. So we're going to be calling them out one after the other to give them their special certificate of participation and their first responder kits as a way of recognizing their role in this pre-hospital care sector in the state and within our communities. So I'm going to be starting off right now. Special thanks to the director of Lasambos, Dr. Kola Korolo, for making this strategic partnership possible. I'm going to be starting with our first candidate, Mrs. Oduyebo Adebisi. Please, can we give them a round of applause as they come forward? But before you come, please excuse me. I'd like to invite the Senior Executive Officer of the Trauma Care International Foundation, Dr. Jumoke Akinsoya. She's going to be presenting to them their kits and their certificates. So our first recipient is Oduyebo Adebisi. We want to see you smile once you come up here. And right next after her, we have Olanrewaju Nike. We want to see a beautiful smile. Right next is Shitu Fatima. And right after Shitu Fatima, Akinshare Regina, please get ready. You're next. Can we keep the applause going? And right next after Regina, we have Adenike Oloyede. Please, can we give her a round of applause? They are doing a fantastic job. Akinola Busayo. Ever smiling. Right after her, we have Esther Oladayo. And right after Esther, I'd like us to give a round of applause to Makinde Beatrice. Right after her, we have Antonia Bankole. Let's give her a few minutes. Ololade Ramat Akombi is next. And our last recipient for this aspect of the program for the Lasambos is Balogun FM. We have another collaborating organization, the Scouts Organization of Nigeria. So I would like to invite Babatunde Michael to please step forward. Can we give him a big round of applause, please? They are young but very effective. Come to the other side. Right after Michael, we have Makinde Solomon. So that's a special reflector jacket to make sure that while they're moving around, be it in the evening or during the day, you can easily identify them. And also, the people in vehicles can see them. Please, can we give them a round of applause? Makinde Solomon is next. And right after him, we have Kehinde Abraham. Each of these people has been a beneficiary of the First Responder Network training. Kehinde Abraham. Right after him is Suleiman Ibrahim. And the last for this segment is Okikiola Precious Taiwo. So let's give Taiwo a special round of applause. Thank you very much, Ma. That concludes this segment of the program.
Thank you so much. I just wanted to reiterate that after each training, we have certification for everyone that we have trained. And for the medical personnel, we go the extra mile of providing the AHA trainings because of the BLS, the Heart Saver, the family and friends, etc. Now, we also gift the first aid pouch. It contains basic first aid materials. And once the person has been activated for an emergency and has used it, we actually replenish the supply. So we have sponsors that help to replenish because we want, the volunteers have done enough by volunteering themselves. We don't want an additional cost for them. So once they have used it, and the way we know is you responded to an emergency, we knew the kind of emergency, you are authorized to go back to the office, the command center, and refill your pack back so that at every point in time, our volunteers have supplies to respond to emergencies. So it's one of the ways in which we are asking those that want to collaborate with us, sponsor this training, sponsor this first aid supply, you can see what we are doing, you are welcome to join us. Thank you so much.
Please put our hands together for her. I like that aspect of the replenishment. I was already thinking, so what's going to happen? But now we know there is even more hope. All right, so don't, as you help more people, more kids are coming to you. Please put our hands together for TCIF. So we'll be taking a vote of thanks right away, and after that, we'll have a photo session with our special guests and our first responders that are here. We would like a photo session, and then we want to thank our very, very distinguished special guests for their patience and their active participation. Pastor Dr. Jumi, please.
Thank you so much. Once again, I actually appreciate everyone that has been here, the representative of the Honorable Commissioner of Health, the representative of, the sector commander, and of course the director of Lasambos. I appreciate every one of our inductees, those that just got inducted into the TCIF First Responder Network. I appreciate the representative of the COFI. Thank you so much for everyone. Gentlemen of the press, thank you for coming. And I just want us to remember that this laudable and innovative technological solution will save the lives of many in our nation, starting with the city of Lagos. And it is part of Trauma Care International Foundation's strategic contribution to improved pre-hospital emergency care in the nation. Our studies have shown that delays in reaching trauma victims can increase their risk of permanent disabilities and even death. It is our goal to work closely with government, strategic communities, and corporate organizations to significantly reduce the emergency response time in our communities while championing volunteerism in pre-hospital care through the TCIF First Responder Network and the usage of the TCERA applications. Thank you, distinguished ladies and gentlemen, for taking out time to attend this auspicious occasion. We deeply appreciate your presence and we look forward to a productive partnership. Thank you once again and God bless you. At this time, I would like esteemed Pastor Dr. Emeka Eze to take the closing prayer. Thank you.
Let's pray. Father, in the mighty name of Jesus, we thank you for this time. You are the author of life. You are the author of wisdom. You are the sustainer of life. And you are the repository of all human wisdom, knowledge, innovations. Thank you for providing this solution to problems of urbanization, of development. For every human endeavor, Lord, you have solutions. And we thank you for the patron of the Trauma Care International Foundation, Reverend Chris Oyakilome. Thank you for the wisdom and the impetus that you put in him to make this available. And we believe that it's going to go far beyond Lagos State and all over the world. Lives are going to be saved by the power of God Almighty. We thank you for the chairperson of the Trauma Care International Foundation, Pastor Diola Phillips. Thank you for the efforts she has put in to actualize the dream of the patron. Thank you for the members of the TCIF, the Volunteer Medical Corps, and the Love World Medical Missions in making this a reality. Thank you for every first responder. The Spirit of God is upon every one of them to save lives all over the world. We thank you for our guests today. Thank you for bringing them to add so much value to today's occasion. We are going home today, every one of us taking away more knowledge, more inspiration to do this work. It's a work of God to save lives. Hallelujah. We also thank you, Lord, for every member of the media, the press that is here today, that the information that will go out will enable many others who are interested in saving lives to be a part of this network. We will receive many more callers, people calling in to find out how they can be a part of it, so that more and more lives will be preserved in the mighty name of Jesus. Thank you. We pray for everyone as you go. You are going out with joy, you are led forth with peace, and you are coming back another time when we want to review the work we are doing and upgrade it. We will all have testimonials to the effectiveness and the impact of what we have launched today all around the world. Hallelujah. Praise the Lord. Thank you very much. And we declare that the grace of the Lord Jesus Christ, the love of God, and the fellowship of the Holy Spirit is with all of us now and forever. In Jesus' name, amen.